Hello, First Wellness family. I wanted to talk about my three favorite stories I've had over the 20 years of chiropractic from misinformed healthcare providers, sometimes medical doctors, about chiropractic. And it's hard because, the patients don't know what to believe. They go to one person and hear one thing and another person and hear another thing. And it's hard because they get mixed messages a lot. And so long time ago when I very first started out, one of my favorite ones was I had a patient come in and took their picture, their x-ray from the side of their neck, and it was, they were supposed to have a good curve in there. Not only was there no curve, not only was it straight, but the curve was going the opposite direction. Extremely bad posture. It's called head forward posture. And eventually over time it blows the disc out. People that have cervical disc problems a lot of times have zero curve or reverse curve. And so it's very, very important to get the curve back in there to take the pressure off the disc. And so I'm like, this is a big problem. We need to get this addressed sooner as opposed to later because the disc will not be able to take this pressure for very long. And of course, the patient was alarmed at hearing that. All they thought was they were just having some neck pain, maybe some pain down the arm, but it has the potential of becoming a very, very big problem. And so what they did is they went back to their orthopedic, and of course they took the x-rays that we produced, took the x-rays over to their orthopedic and showed the orthopedic their x-rays and was like, yeah, my chiropractor said I have a problem, reverse curve, putting a lot of pressure on my disc. And that the orthopedic told him, no, he probably just told you to lean forward when he was taking the picture. Blew my mind. Okay, that was their posture. We never modify posture when we're taking our x-rays. We always want to see where you are in your neutral posture. In your everyday, I always like to say, stand like you're waiting in line for movie tickets, just so you're in your neutral posture. Blew my mind that somebody would say that. I also had another patient, had come to me for years and years and years and years. Went to see, I want to say it was the head ENT surgeon at the major hospital here in Austin. And he happened to mention just off the cuff that he was going to see a chiropractor, and the head ENT said, "Whatever you do, don't go see the chiropractor because you could have a stroke." I think the ENT said that over the past year, something like 3 people that he had seen had a stroke from going to see a chiropractor. Blows my mind. He shouldn't be allowed to say that because it's not true at all. But they can say it and get away with it because he's the ENT, right? And so if it were true, again, I talked about this on one of my previous videos, my malpractice insurance would be through the roof, okay? My malpractice insurance is next to nothing because we don't do that, okay? There was one study that came out that said you're more likely to have a stroke walking down the street than you are going to see a chiropractor, okay? So it'd be nice if some of the facts would get out there. My last but not least, this just happened a couple weeks ago. I had a patient that was coming in, an older gentleman, and was again had some pretty good arthritis going on the neck. A lot of the arthritis was from losing that curve over time, having that head forward posture. Especially these days, we're on our phone so much, we're losing it more and more. And we went through a series of treatment, got better, didn't get perfect, but at least we got the pain to come down a little bit. Ended up going to see his medical doctor, and his medical doctor says, don't go see the chiropractor, all you have in your neck is old age. Blows my mind. That's what we're trying to slow down and prevent. The more alignment we get back in there, the less old age happens. The more curve we get back in there, the less old age happens. The less wear and tear on your spine, the longer it lasts. That's the whole point of what we're trying to do, okay? So it just blows my mind. It's hard for patients because they're getting these mixed messages from one side and the other. They don't know what to believe. And so if you have any questions, ask, but please don't. I know you're getting it from your friends, getting it from family, getting it from other providers. Ask when somebody tells you something just so you can hear both sides of the coin and then make an educated decision, okay? But just don't take somebody's word for it and go from there, even if they're in the area of no. So hope this video helps. Let me know if you have any questions. Thanks for watching.